tomorrow I'll be getting the result. So depending on that, they will decide Visalon how much
Yeah, how much they
will
can
be
reduce. Yeah,
reduced
yeah.
or not.
So you are
And
seeing Dr. Vinita? Are you seeing Dr. Vinita or who? St. John's or where?
not St. John's. I am going to Aster CMI, Airport
Astra
Road,
CMI. That's a good hospital. Very good
Dr.
hospital. Don't worry.
Chaitana. Dr.
Yeah, yeah, yeah.
Chaitana.
All are good. Have faith in your doctor and tell the, because the doctor is also trying to do the best for you.
Yes,
Sometimes the side effects are significant, but we have to save the kidneys, we have to save your eyes, and we have to make your life comfortable. So we have to use some drugs because without drugs, what can we do?
and I don't know. After I started taking these medicines, my face is like swelling day by day, day by
Yeah,
day.
yeah, yeah. Don't worry, it will come down. When your steroid dose comes back to normal or you are very low dose, you will come back to normal. So don't worry, give it some time.
My hairs have
First,
gone. I'm
no, no,
going
no,
bald.
everything will come back. Everything will get normal. First, first 3, 4 months are really very difficult. We get lots of side effects. We get lot of things because we don't know about them. We are also very worried. Gradually, the steroid also come down. All the side effects will reduce. So don't worry, don't worry. Just hold on to your thing like this. Yeah, I will get better.
Because I am a bank employee. I'm an assistant
Yeah.
manager in a government bank. Until my eyes, I said before my eyesight, like I was working fine. But because of this eyesight, I'm not able to see the screen
Yeah, yeah, yeah.
properly.
So you have to go back to your doctor tomorrow and talk to her,
Mm.
Chetna, and tell her that my eye is a big issue. So they will reduce your prednisolone. Definitely, definitely.
My eyesight will come back to normal,
Yes,
right?
yes. Generally, it comes back. Generally, it comes. Whatever patients I have seen, when we have reduced steroids, even if the disease was bad, we had to come down. There is no other way. And
Okay.
it improved.
And Septimune, 360 mg in the morning and 360 at night.
No, so you have to talk to your doctor because we cannot decide on treatment here. We are looking at side effects. So steroid side
Okay.
effects will be there in the beginning.
Will
So
be
don't
there.
worry. It will come back. It will get
Hair
better.
growth also will be back to
Yes,
normal.
yes, yes. Yeah, yeah, yeah. So
Yeah.
we will have one of our new old patient tell you what are the side effects of steroids. So Preeti, can you tell us what are the side effects of steroids? Preeti is our very old patient. So you will be happy listening to
Good
from
evening,
the
ma'am.
patient. Yes, Preeti.
I'm fine. Actually, I'm patient of lupus nephritis since last 20 years almost. And I was diagnosed when I was 16 years old. But today, with the help of and support of Amita ma'am, I'm totally fine. And I think God grace was there, God blessing was there that my doctors are always supporting me. And there are too many side effects, but I have to cope up daily. But though don't have to worry about it. Time will come that we will be used to with all the side effects and we will be like it is life, it will go and go on like this only. So I need not worry about the small side effects, but major side effects I have to deal it with. I discuss with ma'am and hope after some time they may get over also. Right now I am on 5 mg steroids. It's very less dose, and my bp is also in a control condition. So right now, only thing I am facing right now is because of steroids. Ma'am, my doctor told me I may have early menopause because of steroid.
Yeah, yeah. Don't worry. Early menopause will save you a lot of blood. Don't worry too much.
But
Don't worry too much. Everything has good things.
no, she told me that it can be the reason, steroids may be the reason of this early menopause. You have to be prepared for that.
No, no. Even
So is
lupus
this
can have
okay?
early menopause, so that is okay. It occurs in young people, so the disease has some problems.
So
Okay,
like
we will move to
normally
the
it
next
is.
patient now. What? So early menopause is not a worrisome thing. Srajana is writing, I am under mycophyt, that is mycophenolate, prednisolone, losartan, atorvastatin, while Mero abdomen, thigh, body ko, maximum part, stretch marks. Okay. So everybody is worried about the steroid side effects. So stretch marks are a problem if you gain lot of weight because of steroids. So stretch mark is like pregnancy marks. When persons have pregnancy, abdomen becomes big, and when it becomes small, then you have stretch marks. Similarly, if you gain too much weight when you are taking steroids, then when you become normal weight, you will see those stretch marks. The difference is only in pregnancy, they are white colored, And in people who get it secondary to steroids, they are generally pinkish color, because steroids also cause increased blood vessels to make the blood to be seen through the blood vessels. So that's why they look more pinkish. But it's not easy to get rid of them. So Sanjana, don't worry. They generally don't go, and they are generally in parts which are not visible. So they may be in your under the armpit or in the thighs or just in the lower part of abdomen. It is good thing that in our part of the country, we don't have to wear bikini and sleep on the beach. So we are always covered both in Nepal and India. So it's a good thing. It doesn't matter if they have occurred. They are not going to cause you any side effects. It is just that they are there. And like pregnancy marks, they don't disappear. If you have a big pregnancy, your baby is big size, they don't disappear. If you have a small baby, they sometimes disappear. Then also they are there little bit. So that is what it is. So we should wear clothes which cover them up. That's the easiest way. Okay, Shadab has some question. Yes, Shadab. You will have to switch on your mic, Shadab. We can't hear you, Shadab. Just switch on your mic or you can rejoin. Sometime it happens. Yeah,
Yes,
now
ma'am.
we can hear you.
Yes, ma'am.
Yeah,
Ma'am, recently I visit SGPGI और हम मिले भी
yeah.
थे ma'am in that session. Ma'am, they prescribed me Vitcofol injection,
Okay.
1 ml,
Yeah.
and with NS, 100 ml NS.
Ah,
So I took it and थोड़ा सा I got some heaviness on my chest while getting that injection.
okay.
So is it okay? Is it normal? I mean, they have told me that I have to take it once a week. I mean, weekly I have to take it for 1 month.
So actually, it's a B12 injection. You must be having
Yes,
B12
ma'am. Yes,
deficiency.
ma'am.
So it
Yes,
is
ma'am.
no drug, it's only a vitamin injection. If you're
Okay.
finding that it is not suiting you, one option is to change the brand. Change the
Okay.
brand and see. You can get
Hmm.
another brand.
Okay, ma'am.
Methylcobalamin, instead of Vitcofol, you can get some other brand. You can go to the chemist and tell him that I want another B12 injection. There are
Okay,
many
ma'am.
available. That is one
Okay.
option. But if it happens next time, then you just change to tablets. Only problem with tablets is the tablet very little goes inside the body. While injection,
Yes.
everything goes inside the body. So you recover faster if you have B12 deficiency. So that is the only
Yes.
thing. So if you don't
So
feel comfortable taking injections, best is to
the
take tablet.
the only thing was that, ma'am, I have not got that nausea or vomiting kind of thing. Nothing was there. No palpitation was there. Only the thing was heaviness on my chest
Yeah, so
while
anything
getting
can
while
happen.
getting the
All injections can
injection.
give you any side effects. Every patient can have different side effects. So
Yes,
one
ma'am.
option is to change the brand if it was because of that brand. If it
ठीक.
is not that, you talk to your local doctor where you are getting it. Talk to your local doctor, or you can write in the group. We will tell you alternative brands, and then
Okay,
you
ma'am.
can take one more. If it again happens, take a tablet. We will write the tablet also for you. Okay.
Tablet, they are, I mean, the doctors told me that he told me that after 1 month, जब हम जाएंगे वापस, so he will give the tablets.
So if you don't tolerate it, like, or we 90% of patients don't have any side effects. So
Yes,
it's
ma'am.
good. But if 10% have, you always have an alternative. You always have an alternative.
Okay, ma'am. But ma'am, only while taking it. अभी तो मैं बिल्कुल ठीक हूँ. Right now, I'm
इंजेक्शन के
all
टाइम
right.
ही होता
I
है, जो
don't have
साइड
any
इफेक्ट होता है
problem.
वो इंजेक्शन के टाइम ही होता है. तो उनको थोड़ा धीरे लगाने को बोल सकते हैं आप, कि they can
ठीक है.
put it slowly, they can
ठीक
change
है.
the brand and see.
Okay.
Once more you should try. If it doesn't help, always take tablet. Okay.
Okay, ma'am. Ma'am, one more thing. मेरे एक डाउट था कि that they
हाँ.
have prescribed me Telsar 40. तो लास्ट टाइम भी मुझे जब दिया था तो मुझे ऐसा लगता है कि टेल्जार 40 लेने से मेरी डेट्स मेरी पीरियड्स जो है वो जल्दी आ जाते हैं. तो ऐसा कुछ होता है कि ये सिर्फ मेरी ही सोच है या क्या
देखो
है?
भैया पूछे हमारा who is the oldest patient who will tell us? जी, tell me sartan खाने से क्या, you mean do you get early periods with tell me sartan?
टेल्सार 40.
That is tell me sartan. The drug is tell me
Yes,
sartan.
yes, ma'am.
So who is taking tell me sartan? Anybody in the
Ma'am,
group?
I am taking.
Yeah,
So
I was
Mudita, can you tell
taking.
us,
Yes,
do
I
you
am
get
taking.
early periods with tell me sartan? Patient will
Uh,
tell you, then you will know.
Yes, ma'am.
no, ma'am, I don't think, because
No.
once my lupus was diagnosed, after some time only I got menopause.
So it does not cause. It is not known to
Ah,
cause early periods.
Because I'm taking telmisartan from, I think, 2012. Because earlier I was not knowing it is lupus. Because of that, I suddenly have the BP rise, and sometimes it is very low. So,
But I
so
don't
then
have
I was
BP
taking.
problem. मेरे पास मुझे बीपी की प्रॉब्लम भी नहीं है. They have given me
It is being given for you for something else.
for
Some
something else.
palpitation or other
But
thing
it is
might be
not
there.
related to that. Not related. Not
Okay,
related.
It is
okay.
not
Thank you so
related.
much, ma'am.
Yes, yes.
So,
Thank you so much.
who else has a question next? We should have the newer persons.
Yes, doctor.
So, Mudita, you will have to find out who are the new people.
New, I'm here, Catherine. New.
Yes, Chris, we have talked to you. We'll see, give chance to others, and then come back to you. So,
Okay.
Ria, you have any questions, Ria?
Be open. This session is for you guys only.
Okay. Preeti is asking, what are the diet changes if I have high uric acid level? So high uric acid levels in patients with lupus occur when they have some little bit kidney is filtering less of uric acid. Or sometimes there are families which have some mild genetic defect where there is increased uric acid production and less excretion. Like you must have seen in your family, a lot of people get gout, especially it happens in males. In ladies, thank God, God has made us different and we don't get gout till we have menopause. So that's a good thing. But if you have little bit of kidney disease, sometimes you can have increased uric acid. So the foods which have high uric acid, we should avoid. The thing is, one is cold drinks, fructose food. That is a cold drinks. Don't take cold drinks if you have high uric acid. It contains a lot of uric, carbonate drinks. Second is red meat. But I don't know, in India, a lot of people don't eat red meat, and people who call them non-vegetarian also eat it once a week. So that is not much of a non-vegetarian food. So, and so these are the actually two most important high uric acid diets. So cold drinks and red meat. Rest for vegetarian, there is nothing needs to be avoided. You can eat everything. But only thing is that if you eat 3 katoris of rajma, that has high protein. So it will get in the body changed to uric acid. So you can have 1 katori of rajma or 1 katori of chola or a big katori of dal, but not that you're eating 3 katoris of dal at one time. So that is the only thing. But for vegetarian, there is nothing needs to be avoided. Then Asta has a question.
Yes.
How
Yes,
can we
ma'am.
manage the emotional and psychological impact of living with lupus? Okay, so let this be answered by patients. So we have Mudita, we have Babita. They will tell you better than what I can tell you. Yes,
Babita ji, are you
Babita, we
telling?
can start with you. You
Yes,
tell us,
yes.
how did you cope up? So is
Where
Babita
is
there?
Babita ji?
Okay. Yeah, ma'am. I'm
Yeah,
here.
Babita, you tell us. You are the best person who has coped up with this illness.
I think it is best by the Mudita ji.
Why?
She's doing lot of things like healing, meditation, healing.
Yes.
Yeah.
Yes. For the self-management, we need to do something, because emotion is something which cannot be taken care by outside. Even you take medicine, go to psychiatrist, still they can give you medicine, but until unless you decide to take care of your emotion, you cannot make it. So somehow you have to be watchful for your emotions. If you are being so negative, try to be around the people who elevate your mind or emotions, or who love you more and who accept you the way you are. This is very important, right?
Yeah, that's lovely to know. I would
Yeah.
really also want to know more about how other lupus patients have been managing, because this is like we constantly have this, we constantly with all these
Self-love.
conscious effort, we're trying to
Self-love is very important.
drag that particular thing with us, but then with all the societal
So
pressure and
I will tell you the
everything.
best way. Best way, I mean, because I'm not the patient, so I cannot say it's the best way, but it is one of the important ways. Is one that you need to share your illness only with limited number of people,
Yes,
because
yes,
the communities in Nepal and India, we have a very close family network.
yes.
Everybody will come and ask you, Oh, Asta, how are you? How is your disease
They
going?
make you
And then
sick.
you will say, oh, no, no, I am not well. Today I am feeling very low. I have body ache. I have this. So you are all the time repeating your illness to all people. And every day you are spending 1 hour talking about your illness. Nobody is going to help you. The only people who will help you are yourself, your family, and your doctor. So only these people you should talk about your illness. Other time, if somebody asks you, okay, Asta, how are you feeling? How's your disease? Say, oh, look, I'm so fine. I look sick? I don't look sick. So then they will not ask you the next question. And your conversation will happen on something else. They may talk about movies, they may talk about clothes, they may talk about a festival. So you will be like a normal person. Otherwise, all the time we are talking of our own illness. So I always tell my patients that talk less about your illness to people who don't are not going to do anything to you. Your family, do talk to them. Everything you tell your family, how you are feeling, what you want, everything. But not to the XYZ. That way you feel more depressed. The second is that always have a little bit of physical activity. Whatever you like, walking, going to play badminton, or you just want to play chess. I mean, even mental games are good. Yoga, you anything, whatever you like. Like I do Sudoku every day. I like to swim. Everybody has a different thing. So, but you need to have little bit of physical activity and little bit of mental activity so that you know that I am physically okay and I am mentally okay. That gives a positive feedback. Like if you can solve the crossword, at the end of crossword solving, how nice you feel. Even it may be a small 5-letter crossword. You feel positive energy coming out of it. If you say, I will walk 1 kilometer a day, the day you will complete 1 kilometer, you will feel nice, I can tell you. So have a target for yourself, whatever target. It may be half a kilometer, but you do it. At least try to do 20 days a day, month. So if you keep your targets small and keep following them up, I can tell you it can make a difference between living and enjoying. All of us are living. Are we enjoying?
Yeah.
And we also have to say that 3 days in a month will be bad. And it happens in a normal person also, I can tell you. It's not only lupus patients. A normal person also, sometimes the boss has said something, you are sad. Sometimes something else has happened. So all of us have low days, no?
Yeah. Agree.
So that is how we have to think. And if you find, I always feel that you should try to find a friend for yourself among the lupus community whom you can communicate with. The day you are feeling low, talk to that person. Call up. Like if you suppose Asta likes Mudita, call up Mudita. Okay, Mudita, today I'm not feeling well. Let's chat, do something just on the phone. That will give you a positive feedback.
Yeah.
Or call your servant's kid and teach him or her for 1 hour. When you do something for others, you feel so nice. So you have to find happiness. It's a way of finding happiness.
Thank you so
So I
much, ma'am.
think that
That's really
works a
helpful.
lot.
Yes, ma'am. Physical activity definitely help. Like I started from past 3 months. From June, I have taken a subscription for my physical activity. I every day I get some scheduled exercises to do, and I saw like my cholesterol, which was never goes down since 2012. It was all of a sudden it's so good. You have seen the reports. So physical activity, it elevates your mind health also and physical health also. You feel happy. And other things like you don't have to talk about the disease. Yes, I practice that. I don't talk the people who just keep on asking about the disease. I just ignore them. I'm good and I just turn the talk कि कुछ और बात करते हैं. So it helps a lot. And even meditation also, I used to do like pranayam also. It helps a lot to calm your mind.
So this is a very important question which everybody asks. Akansha Rai is asking, ma'am, can we recover from lupus? Yes, you can recover from lupus, but it cannot be cured. That we must accept. If we are running after this somebody, some Ved, Hakim, or some other fellow who's telling you that I will cure your disease, it is not correct. there is no cure for disease at present. Maybe in next 5 years, we will have a cure for lupus, but not today. So don't get carried away by this. Like diabetes. When we get diabetes, do we ever ask anybody? Do you tell your doctor, ask your doctor ever, will my diabetes get controlled? No, because you know diabetes doesn't get cured. Hypertension, high blood pressure. All of us know once high blood pressure, always high blood pressure. So same way, this is another disease which is like that disease. Once it is there with you, but you can live comfortably with it. You can have few days bad and lot of days good. So think like that. Don't keep on thinking, will it get cured? Will it get cured? That gives you so much of negativity.
Yeah.
Like if I have a nose like which is crooked, I will stay with that nose. Now I'm not going to get a plastic surgery done and this, that. All of us have, some people are wearing spectacles. Are they running around to doctor ki get rid of my spectacles? No, they have accepted that I will wear spectacles. Same way you accept that I will have lupus, but I will try to keep it under control as much as possible with my medicines, with my effort, and I will have a good time with it. Then we have another question from Lakshmi. Lakshmi is asking, she has proteinuria. Can she make some change to diet? So the thing is that why does proteinuria happen? Why does your urine starts leaking protein? It is because we have like what we have when we pour tea strainer. If you pour it with high pressure, some amount of tea leaves also go in. If you pour it slowly, no tea leaves go in. So what happens is that one, your strainer has become little loose. So more protein is coming out. Second, if you keep your blood pressure high, then more protein will come out. So what we tell everybody, that even if you don't have high blood pressure, we give telmisartan, because that reduces the blood pressure plus also decreases the amount of protein which comes into the urine. It is not a drug which acts on the immune system, doesn't make you sick at all. So that drug should be taken by all patients who have proteinuria after talking to your doctor. Second, diet. If you are losing too much of protein, then you must take proteins, because it should not be that you become totally protein deficient. So you need to take adequate amount of protein also. So, but there is no diet which can reduce your protein coming out of the urine. And second is that if you have a lot of swelling in the body because of protein coming out, reduce your salt intake, because too much salt can also make your fluid to accumulate in the body. So reduce salt intake means take half a teaspoon of salt. That means the salt which we add in dal, sabji, that is all. Don't add salt in your dahi. Don't add salt in the salad. Don't take namkeen, bhujia, samosas, achar. Achar has maximum amount of salt. So avoid salt in all those salt. If you have lot of edema or you have high blood pressure. So those are the things you can do, but there is nothing you can change to decrease the proteinuria. Then we have a question from Amit. Amit wanted to ask, had raised some hand. Yes, Amit.
हेलो मैम हेलो
Hello.
मैम गांधी
Hello.
जयंती की शुभकामनाएं शी इज
हाँ,
नव्या
yeah,
हाय करो
yeah.
उनको
Hello, Amit. और
मैम
नव्या,
कैसे हो बढ़िया हूँ। मैम आई हैव अ टू क्वेश्चन एक्चुअली
yeah.
एक तो अभी एक रिसेंटली एक पेपर रिलीज हुआ है शायद स्टैनफोर्ड यूनिवर्सिटी में जहाँ पे कुछ क्योर जैसी बातें की जा रही हैं फॉर द लूपस मतलब पॉसिबल
हाँ,
कॉज उनको शायद
वो
आइडेंटिफाई
मैं
हुआ
बता रही
है
हूँ आपको, चलो पहले उसकी बात करते हैं। तो मतलब मेरी जिंदगी में 40 साल से मैं लूपस देख रही हूँ। मैंने पहला मरीज 1980 में देखा था, तो 80 से लेके 45 साल हो गए मुझे। 45 years I have spent seeing lupus. So this is the
Yes.
first time we are so excited. Actually, last year this thing came. They had
Okay.
given CAR T cells to 5 patients with SLE, and
Mhm.
they are totally off drug. The first patient who has got this therapy is now off treatment for last 3 years, 1,000 days.
Great.
So 3 years and 100 days. So 3.25
Yes.
years. And then now the follow-up paper has come, which has come this year. There they have given to about 15 patients of lupus. This is from
Okay.
George Schett group in Europe. And
Mhm.
all of those patients are without drug.
Wow.
So in India, the cost of that abroad is 3 crores, but you must be
बहुत
happy to know. No, so you may be happy to know that in India, IIT Bombay, one person has made these CAR T
Wow.
cells in India. It is costing only 30 lakhs, and we are planning to start a study on that very soon, maybe
Okay.
next 6 months or so. So we will
Okay.
only take patients who are bad, who have not responded to therapy. Those are the only patients who are given this because it is
Okay.
still an experimental therapy. It is
Okay.
not because it has been tried only in 15 patients in Europe and maybe about 3 or 4 patients in USA. So, but in India, the cost will be around 30 lakhs, not more than that. And we will be doing as a part of project. So we are trying to get money from the government. So that's why we've been discussing for the last 2 months. And we will submit a project. And once it gets funded, we are planning to do about 20 patients, 10 to 20 patients.
It's a
So
big ray of hope, ma'am, actually. और
very good.
कॉस्ट तो कम हो ही जाएगी.
Yeah, so we are hoping that. So we hope that that's why I said that in 5 years' time we might have a cure. So keep up your spirits. Don't give up anything. We might have a cure for this disease, and then you will be living life without drugs.
Great,
So
ma'am.
we are trying to get that thing, and let's hope we are able to
Ma'am,
reach.
I have another question for the personal
Yes.
point of view. Actually, नव्या को Humira की doses चल रही थी over the मतलब interval over the 15 days, 15 दिन के days पे 5 dose दी जा चुकी थी. उसके बाद अचानक से थोड़ी इसकी तबीयत खराब हुई, तो मैं अपने एक डॉक्टर के पास गया. वो होम्योपैथिक डॉक्टर थे जिन्होंने मेरा काफी हद तक सोराइसिस को क्योर किया था. नव्या, मैंने उनकी ट्रीटमेंट इनसे शुरू करी, होम्योपैथी की ट्रीटमेंट, एंड काफी हद तक मतलब उस वक्त बहुत तेज बुखार आ रहा था, इसको पेट में दर्द और भी डिफरेंसेस प्रॉब्लम थी. वो सब ओवर द 1 वीक सारी ऑलमोस्ट कंट्रोल हो गई. और अभी मैम 2 से 2.5 महीने हो चुके हैं. वी आर नॉट गिविंग एनी मेडिसिन एंड शी इज वेरी मच अंडर कंट्रोल.
Oh wow, very good. We are very happy.
तो एक्चुअली मैं ये जानना चाह रहा था, मतलब मुझे तो पूरा विश्वास है कि होम्योपैथी ने काम किया है, बट आपका एक पॉइंट ऑफ व्यू लेना था कि क्या ये डिजीज ऐसी है कि दवाई ना देने के बावजूद भी रिमिशन में अपने आप चली जाए, या
देखो,
एक्चुअली होम्योपैथी नहीं काम किया है?
So the thing is कि इस disease में this disease has up and downs. Remission and relapses are well known. There are patients who stop all drugs and stay well for years. There are patients who stop drug when like COVID time. Lot of patients stopped drugs. They could not get drugs. They stayed well.
Okay.
Some of them had very bad disease. Some we lost also. Some died because they could not get drugs. But lot of them who were well controlled, who were doing okay, stayed well for 2 years without any drugs. So that can happen. In these diseases, ups and downs are known. In old time, when we had very little drugs, some patients used to recover on their own without much of treatment. Before steroids came in 1940. Before 1940, also lupus patient used to recover, but only a small proportion used to recover. So these diseases, for anybody, it is very difficult to say what works and what does not work. But for Navya, if you think that has worked, you should get her test done. Has her complements gone to normal? Has her dsDNA antibodies have come back to normal? That will tell you that it is working at the disease level. That has all the abnormalities which she had, has it improved or not? So that will make a positive thing. And because I always say that all of our drugs are coming from plants, like chloroquine. Chloroquine is coming from a bark of a tree. So homeopathy also uses things from plants, from other metals and other things. So it could work. So we never say no. We say, okay, but we don't know. We are not trained in that. We have no idea. And if it doesn't work for you, please stop it. If it works for you, you can try it out. So most chronic disease patients always try other drugs.
Zoom live session तो मैंने link भेजा है Zoom का, देखो आपके नाम.
So those are the things. So we never say no, but you can come and we can do the test, whatever she
Definitely,
had
ma'am.
abnormal, and we will have a look at it. So
Next
we don't have
OPD,
negative
I will come.
attitude to anything. I have a very positive that anything patient wants to try it out, let them try for 3 months, see if it works.
Definitely. Bilkul.
Yeah.
Bilkul.
We have a question
Thank
from
you.
Deepa. Deepa is saying, I have lupus for 3 years. Regarding diet, sour products, khatta cheese, tomato, lemon, amchur. So, and she had urinary tract infection 2 times. So, Deepa, don't think that if you eat khatta, then only you get urine infection. No, that khatta, when you eat, once it reaches your body, it is converted into the same thing. There is nothing called khatta, meetha. It is only for taste. So you can eat anything. And lemon, how much lemon do we take? It has vitamin C. It has good things also. Amchur is also good. Tomato is also good. Every food is good, but we have to take small amount. And for urine infection is very common in ladies. And as you are seeing that most of the patients are ladies. Lupus predominantly occurs in ladies. So we need to prevent urinary tract infection, urine infection. And the way to prevent are four things. Drink lots of water. Go to pass urine at least every 4 to 5 hours if you are having urinary tract infection, if you have ever had it, because that way your urine tract will get cleaned by the urine. The third, at any time you get burning in the urine, go and check your urine. If it is showing pus cells, get your culture done. Get treatment done very fast, because otherwise your kidney can get little bit of damage and you will also feel miserable. If you get more than 2 infection in a year, then you need to take antibiotic for 6 months consistently. The other thing which in our country is people use those jets, water jet from behind. That is a very major source of urinary infection in ladies. So do not use jets. Use only clean from front. Put water only from front, not from back. And the last thing is that dry out. After you have passed urine, you have washed with water, dry that area. If that area stays wet, then also the risk of infection increases. So if you do all this, it will help you. Then somebody is saying that Deepa is saying, I am not able to get my prednisolone below 10 milligram. If you are not able to get below 10 milligram, you have to talk to your doctor. Maybe your other drugs are less in amount. You can increase other drugs and decrease this drug. But your doctor is the best person to tell you. Because there are some patients who cannot come down below 10, but there are very few such patients. Very few. Okay, then we have some male persons. Let's hear from the males. Pankaj, आपका कोई प्रश्न है? पंकज जी, आपका कोई प्रश्न है? Okay. Then we have Zeba. Zeba is asking, I want a family plan. So she is suffering from lupus for 7 years. So this is a very important question. When you get married, you want to have baby. When should you have a baby? Baby, you should only plan pregnancy if your disease is well controlled for at least 6 months, and best is if it is controlled for 1 year. Before you plan pregnancy, talk to your doctor. All the medicines which are not good for pregnancy need to be changed. Like if you are taking mycophenolate, we will have to change mycophenolate to some other drug like Azoran, which is safe in pregnancy. If you are taking methotrexate, that will also have to be stopped and changed to something else. So even your blood pressure medicine, some blood pressure medicines cannot be given in pregnancy. They also need to be changed. So you talk to your doctor that I want to have pregnancy. They will change your medicine. They will check your antibodies. Some of the antibodies can have some effect in pregnancy. So they will check that do you have any of those. They will counsel you. And then you should have pregnancy. Once you have pregnancy, you have a dialogue with your doctor, the gynae doctor. The gynae doctor are not comfortable. They don't know SLE. So they will scare you. They will tell you, you go abortion, don't have pregnancy. So you come to your rheumatology person and talk to them. They will, like I write always a note to the gynae doctor that this is what is to be done. These drugs are allowed, these drugs are not allowed, do normal delivery, don't need to do extra ultrasounds. Only for this patient, you need to do more ultrasounds. Everything we write it down and give it to them. So that way the gynae doctor is also empowered. They feel nice that they are managing a patient with lupus. So they take extra care for those patients because they like it. They have never seen. So they are seeing for the first or second time. So they also give you extra care. And then you undergo pregnancy. So you can have a normal baby. So lupus, if you have lupus, generally there is some increased risk of abortion. The baby is generally born early, normally between 8 to 8.5 months. If you have high blood pressure, your blood pressure can go up during pregnancy. So buy a BP apparatus, check blood pressure at home. If it is going up, talk to your doctor. And if your baby may be a little bit less weight if you have blood pressure problems. If you have nothing else, then generally it's like a normal baby. Cesarean is not required in most of the patients. You can have a normal delivery, but you have to talk to your doctor because your doctor is the best person to decide based on what treatment you are on, how is your disease, everything. They have to see. Okay, Ishita, I am having hair fall. I am on prednisolone, MMF, and HCQS. What should I do? If you have too much of hair fall, first see that this is not the first sign of disease coming back. If it is too much, all of us have hair fall. But no lady is the one. If you ask even a normal person, they'll say, "हाँ, मेरा बाल गिर रहा है." So if it is more than normal, and especially post rainy season, some people say there is more hair fall. I don't know because probably the hair is not that clean because in rainy season there is a lot of moisture, so you get more infection, mild infections in the hair. So there is a more hair loss post rainy season. But if it is too much, then always come back and talk to your doctor and see. But if you are on hydroxychloroquine, does not cause hair fall. MMF usually does not cause hair fall. And if you are not taking large amount of prednisolone, you're on a 5 to 10 milligram, then generally it does not cause hair fall. So you have to see the reason for that. Okay, Akansha Rai is asking, ma'am, treatment for mouth ulcers. So mouth ulcers can occur because of many reasons. One is disease itself. But those ulcers are generally painless. In SLE, generally ulcers are painless. They will occur on the top of the mouth and they generally don't cause much problem in eating. If you have an ulcer which is causing you pain and causing you difficulty in eating, always consult your doctor. It means that maybe there is secondary infection, either with a fungus or you have a viral infection like herpes, or there is bacterial infection that it is not clean. So whenever you have ulcers, always wash your mouth. Whenever you eat, even if you've eaten one biscuit, wash it. Because if something stays there, it will keep on causing more infection. So, and you can apply a local anesthetic, which will cause, like when we go to get surgery, they put anesthesia, no? So you can buy a cream, which is called Gelora or a lignocaine cream, and you can put it on your finger this much and apply it on the ulcer. So that will decrease the pain, will allow you to eat well. But so those things you can do yourself, but rest you will have to ask the doctor and then do it. So who has raised hand? So, there is somebody who's asking. Madhu Sharma, what is your question, Madhu? You can ask your question. We didn't read it. Madhu Sharma's question is, I am not getting my periods for 4 months or very little period. It has been happening for past. The doctor has said it is due to hydroxychloroquine. No, no, no. Hydroxychloroquine has no effect on periods. Their reasons for less periods can be multiple. One, if you are on high dose prednisolone, because that is a hormone that can affect your periods. Second, if you are near the age of 40, it could be early menopause that your periods are coming less. If you are young and your period is not coming, please do pregnancy test because you may not know and you may be pregnant. So always do pregnancy test because some drugs, as I told you, are not good for pregnancy. So in those cases, you have to go to your doctor and tell them. So I am worrying whether my period will stop permanently. So if you want to check, you have to go to the doctor, get your hormone test done. That can tell you that is it stopping or is it some other reason. If you are young, if you are less than 40, please go to your doctor and get your test done. I hope I've answered Madhu's question. Then we have question from UHS. I have back pain from last 3 months. No painkiller giving me relief. When I take tablet, it gives me relief. Or when I take antacid, it gives me relief. So if you are getting relief with antacids, then it is coming from stomach. But I am not sure if it is a back pain. Generally, back pain doesn't occur because of acid problem. Acid problem gives you pain in the front of the abdomen. And you will also have some sour taste and other things. So if you are having back pain and you are on steroids or you have lupus for many months or years, please get an X-ray done, because lupus can also affect your spine, and the steroids can also affect your spine, and sometimes the spine bone can become like this. So that can give you pain. So just get an X-ray done from the side of your vertebrae. Ask them to do a side X-ray and see that the bones of the spine are all normal. So that is most important, because lupus patient can have vertebral collapse. Steroids can give you vertebral collapse. We are taking drugs which increase risk of infection. So an infection in the vertebrae can give you pain in the back for 3 months. If you had a baby recently, that can give you a pain in the back. So there can be
No,
many
ma'am.
reasons. So
No,
you have to
ma'am.
figure out
No,
what
ma'am,
can be the
मेरा
reason.
lupus, ma'am,
Yes.
remission with, ma'am, my lupus is in remission from last 5 to 6 years.
Okay.
और
How
अभी
much prednisone are you taking?
currently भी मैं टेस्ट करवाई हूँ तो मैम lupus का सारा टेस्ट नॉर्मल आया है.
नहीं, prednisolone कितना खा रहे हैं?
मैम नहीं चल रहा, बस
नहीं चल
HCQS
रहा है.
300 चल रहा. Only
So then
HCQS
get a X-ray
300.
done. X-ray of your spine first, always.
Okay, okay.
Because you have lupus for how many years?
It was detected in 2017 October.
So 6, 7 years, no? So please just get an X-ray done of the spine first. And then you can talk to your doctor. If it is still persistent, please talk, because it does not mean that lupus patient cannot have any other disease. That also you have to
ऐसा
think,
भी हो
no?
सकता है क्या, अगर सीटिंग वर्क आपका बहुत ज्यादा है तो वो चीज भी अफेक्ट कर रहा है क्या?
क्या चीज?
सीटिंग वर्क, अगर ऑफिस वर्क का
वो
लोड
भी
कुछ
कर सकता
ज्यादा
है.
है.
सबसे कॉमन कारण बैकएक का पोस्चरल बैकएक होता है. जो हम लोग जो ऑफिस में सारा दिन बैठे रहते हैं, ऐसे झुक जाते हैं, उनको भी होता है. तो
यस
बट
मैम, जब से
ऑलवेज
ऑफिस ज्वाइन की हूँ उसके 3-4 महीने बाद से ये चीज स्टार्ट हुआ है.
वो भी हो सकता है, पर उसके लिए आपको बता दें, वी कैन टेल यू द एक्सरसाइजेस, बट पहले एक एक्सरे कर लो, बिकॉज यू हैव अ डिजीज. So always have one X-ray, that if the spine is normal, then you can do exercises. Lie on your tummy and look backwards. उल्टा मतलब पेट के बल लेट के एक्सरसाइज करना है, जिससे कि आपका स्पाइन का मसल स्ट्रांग हो जाए और वो आपका स्पाइन को स्ट्रेट रखेगा और सपोर्ट
मैम
करेगा.
वो एक्सरसाइज मैं लास्ट 15 to 20 डेज से स्टार्ट की हूँ तो उससे
हाँ
कुछ रिलीफ आया है.
वो आ जाएगा, पर एक एक्सरे
यस
जरूर कर लो. तब भी एक्सरे
यस मैम.
करके देख लो और उसके बाद वो एक्सरसाइज करवाओ. यदि आपको
ओके.
स्विमिंग आता है तो स्विमिंग इज द बेस्ट एक्सरसाइज. इफ यू डोंट नो
नो मैम,
स्विमिंग तो
स्विमिंग तो
स्विमिंग की
नहीं आता
तरह
मैम.
लेट कर.
साइकिलिंग वगैरह कर
हाँ
सकती हूँ ना, साइकिलिंग
है.
में कोई दिक्कत? साइकिलिंग.
साइकिलिंग अभी नहीं करो. यदि बैक एक है ना, साइकिलिंग में हम आगे झुक जाते हैं.
ओके.
तो थोड़ा देर पहले पेट के बल लेट कर एक्सरसाइज करिए, जिससे कि आपका स्पाइन का मसल अच्छा हो जाए, फिर साइकिलिंग शुरू कर.
ओके मैम.
तो वो फिर अच्छा हो जाए. और यदि वेट ज्यादा तो वेट को कम करो, क्योंकि
यस मैम,
वेट
वेट.
ज्यादा होने से भी बैक एक होता है.
यस मैम, वेट ज्यादा है.
तो वेट कम करना है, डाइट कम को कंट्रोल करना है, वेट कम करना है, पेट के बल लेटकर एक्सरसाइज करना है, ऑफिस में स्ट्रेट बैठना है. देखो जो ये चेयर है ना, मैं दिखा रही हूँ, ये जब आप ऑफिस में काम करते हैं, चेयर को एकदम टेबल के पास रखना है, कि आप आगे नहीं झुकना है, आपको सीधा बैठ के काम करना है. यदि आप लैपटॉप में काम करते हैं, एक ऐसा टेढ़ा वाला खरीद लीजिए, उस पर लैपटॉप रखिए और टाइप करिए, जिससे कि आप झुकेंगे नहीं. यदि आप झुकते हैं तो फिर वो बैकिंग बढ़ जाता है.
और
तो वो
मैम
थोड़ा
एक चीज और, मैम अभी रिसेंटली टेस्ट करवाई थी तो वो शुगर का जो 3 मंथ वाला HA1B1 करके जो
हीमोग्लोबिन
टेस्ट है.
A1C.
यस मैम, वो मैम मेरा 6.3 आया है.
तो वेट कम करो पहले.
यस मैम.
वेट कम करो. तुम लोग सब बहुत ज्यादा मोटे मोटे हो जाते हो. वेट कम करो. Okay,
Yes.
we have a question from Devanshi. Devanshi
Thank
saying,
you,
I
ma'am.
had MMF, tacrolimus, cyclophosphamide. I did not get better. Abhi I am taking rituximab. I am persistently having low hemoglobin and high protein dose. So Devanshi, rituximab will take some time to act. Rituximab takes 2 to 3 months to act. It does not act in one day. It is so you wait for the response if it is that. But there are some patients, even rituximab doesn't work, but we will try for 2 times. If it does not work, there are more medicines. Sometimes a simple medicine works better than all these medicines. but those are tried only in patients who do not respond to these 4 medicines: cyclophosphamide, mycophenolate, tacrolimus. These are the first line treatment. Then we try rituximab. If it doesn't work, we will tell you what else can be tried. So don't lose heart. And if you have only proteinuria, don't worry. So, but medicines and lifestyle, I told you earlier that for proteinuria, what we need to do. Okay, then Gauri is asking to prevent bone loss, should bone density test be done? I am taking 5 milligram weekly for past 3 months. If you're taking 5 milligram per week, you don't need it. But if you have taken a large amount earlier, then you can do one BMD test and see that what is your reserve of the bone, because it may have come down and you did not know it. So you can do a BMD and have a baseline BMD that this is mine. If it is low, anyway, all of us should have good amount of calcium. All ladies should take 1000 milligram of calcium, but not by tablet, by food. You should drink milk, eat dahi, eat paneer, eat chach, lassi. So these are very good things which give you a lot of calcium. Like chach has got 300 ml of chach will give you 320 milligram calcium and no calories. So you are not going to grow fat, but you will get calcium. Milk, 300 ml of milk, that is one big cup of milk, will again give you 350 ml of calcium and will also give you protein. So if you take milk which is 2% fat, that milk from which malai has been removed, it does not got too many calories, but it gives you protein and calcium. So you do that, use that. If you cannot like milk at all, then you can take tablet. You can take 2 tablets of 500 milligram. And always take vitamin D, because lupus patients do not go out in the sun. So take vitamin D, 60,000 units every month. It's easy to take one packet. Just put it in a small amount of milk and drink it. Or you can even put it in a water and drink it. So that will prevent bone loss. Okay, somebody is asking, can MMA affect periods? I am taking MMA 4 tablets. Generally, it does not affect. But if your disease is not controlled, then it can affect. So MMF by itself does not affect the periods. It can make the periods little less in amount, but the cycle does not change with MMF. Okay, then Ria. Ria is asking, I have a small nose rash. It's been itching for a few days. Is this normal? No, nothing is normal. If you have a rash, it is not normal. Only thing is, if it is itchy, you have to think that is it allergy? Because at this time, lot of allergies can also occur. Or is it because of lupus? Generally, lupus rash on the nose is not itchy. It can be sensitive to sun, but it is usually not itchy. So if it is itchy, just show to the dermatologist and ask the person. Then Suman. Suman is saying that I had pre-pregnancy loss at 20 weeks and I have persistent platelet count 1000, lac positive. In last 2 pregnancy, low molecular weight heparin was given. Last pregnancy, I had taken low molecular weight heparin full dose and other norm. Can I take prednisolone low dose? Yes. So Suman, your case is one of a very resistant case which did not improve with low molecular weight heparin, both in low dose and high dose. So those are very few patients. In those patients, there are 2 or 3 therapies. And I don't know, you are based in Nepal or you are based in India? Suman, where is she?
We are based from India.
India. So Suman, the things are that there are 3 or 4 therapies which can be tried. One, you are absolutely right. You can take prednisolone. Then there are people who use intravenous immunoglobulins. There is one very small trial of using one statins, pravastatin, which had shown very good result, but there is only one study on that. So these are the things we try. And sometimes we also try, besides these 3, there is one more drug, I don't remember the name, but those 4 are options available to people who have this. The other thing is to use rituximab prior to pregnancy and reduce your antibody levels, and see that also has been tried sometime. So there are options available, but those are all experimental. Which will work for you, we do not know. But there are
Okay, ma'am.
options
Thank
available.
you. Okay, ma'am. Thank you. And what would be the dose for IVIG? Would it be the full dose in 3 weeks interval?
So people have used multiple protocols, and people use IVIG monthly doses of 1 gram every month. So there are because as I said, these are all experimental. So you will find different studies have used different doses. It is a very expensive therapy. So that is the main thing. So, but where are you based, Suman?
We are from Bhubaneswar. Actually, we are treating.
Bhubaneswar. So you can talk to, there are very good rheumatologists in Bhubaneswar. You can go and meet either Dr. Mishra in KIMS, or you can meet Pradipto
Yeah.
in SAM, or you
Yes,
can meet
yes, madam.
Jyoti.
We are actually with Ramnath sir, Dr. Ramnath
Bas,
Mishra.
talk to Dr. Mishra. These are the
Yeah.
options available.
Yes, yes. We are with him. This
Yeah.
time he suggested us for IVIG and prednisol
Yeah.
on 15 mg.
Yeah. So you can try these. These are the standard options. Absolutely.
Okay.
So,
And
okay, Suman,
for
all the best.
IVIG.
All the
Okay,
best. We
thank you,
hope you have a very nice bony baby.
ma'am. Please pray for us, ma'am. Thank you
Yes,
so
I
much.
am always praying for all my patients.
Thank you so much.
Okay.
We all will
Then
pray.
Sumita is saying my anti-dsDNA test is always more than 500. So do we need to do anything? So Sumita, you must realize if your disease is under control, then don't bother about anti-dsDNA. But if your disease is not controlled, then we are bothered. So if you are absolutely fine, nothing else, your everything else is okay. So there is a thing called serologically active, clinically inactive lupus. So this is seen all over the world that there are a small number of patients who will have high dsDNA always. But they otherwise look absolutely normal. They have no problem. They are off steroids and they are doing very well. So if you are one of those, we have about 15% of our patients are like that. Out of 100, 15 people will be like that. So in those patients, we just keep a close watch. We tell the patient that if you have any symptom, please come back early. Please check
Okay,
your
ma'am.
urine every 3 months. Please check your blood count every 3 months, that there is no lowering of blood hemoglobin, your TLC is not coming down, your platelet is not coming down, you're not getting protein in the urine, because rest of it is visible. If you will have symptom, you will know, but blood and urine is not visible. So it may be that something is happening, you don't know. So that is why we tell those patients that every 3 months you get those tests. And if any problem, you come back to us. But don't
Okay.
get carried away by just dsDNA values. Nothing.
Okay. Thank you, ma'am.
Okay, then we have a question. Ishita, my C3, C4 is 90 and 15, perfectly normal. dsDNA 78, perfectly normal. So it is all fine. You can reduce your prednisolone to 2.5.
Okay, ma'am. Thank you. And ma'am, just one more thing, कि ma'am, I had a rash above my eyebrow and on my forehead it was itching. So, ma'am, when I asked my doctor in my last OPD visit, they said it is a fungal rash and you consult a dermatologist nearby. But when I consulted them, I don't know, he gave me treatment for atopic dermatitis, Disonide and tacrolimus solution. So, is it that
Tacrolimus you don't
lupus
need to
rash?
take. You tell him that I am taking already MMF. You are taking MMF?
Yes, yes,
You
ma'am.
don't
I
need to take
told him
that.
all about my treatment, but he gave me all these topical solutions of
So
tacrolimus
you
and
can take it, but
Disonide.
generally on the face, fungal rash is very uncommon on the face. That we must know. Fungi
Okay,
normally
ma'am.
do not affect face. Very rarely it affects face. So
Yes,
it can
ma'am.
be atopic dermatitis or it can be allergic dermatitis. So
Yes,
he must
ma'am.
have given you a steroid ointment.
Yes, ma'am. Disonide.
हाँ, तो बस वो लगा लो, ठीक हो जाएगा. वो ज्यादा दिन नहीं लगाना है. Face, if you put for long
15
time,
days.
becomes very
Yes, ma'am.
atrophic. So not more than
Okay.
7 to 10 days.
Ma'am, but the resonance told me that it looks like fungal, so I don't
कोई
know.
बात नहीं बेटा, हम लोग सब सीख रहे हैं ना.
Yes,
We are
ma'am.
also human beings. So
And ma'am, this atopic.
1% it can
Yes,
be
ma'am.
fungal. It
Okay.
rarely affects the face. The fungal rash
Okay.
rarely affects. So if it is on the face, we think fungal is less likely.
Okay, ma'am. And ma'am,
Okay,
this
don't worry.
atopic dermatitis,
A difference
is
of
it due
opinion
to
will
disease?
always occur in doctors.
Yes,
And the
ma'am. That
more
is
you
not the
read,
problem.
the
Yes,
more
ma'am.
you will know. तो
Yes,
धीरे
ma'am.
धीरे करके सब लोग सीख जाते हैं. कोई बात नहीं. You can just apply steroid ointment and see if it doesn't help, come back to us. or send us
Ma'am,
your
one more
photo.
question.
Yeah. Send
Ma'am,
us
for
a
this
photo.
atopic dermatitis, it is due to my disease only.
No, not because of this.
Okay.
Okay, Devanshi, I've been having bad pigmentation. Okay, so this is a very important thing. I think Mudita also, everybody complains कि भाई हम काले हो रहे हैं, हमारा रंग डार्क हो रहा है. तो मैं यही बोलती हूँ कि देखो मैं डार्क हूँ, तो आप मेरा डॉक्टर का शक्ल देखने के लिए नहीं आते हो. डॉक्टर को तो दिखाने के लिए आते हैं. डॉक्टर अच्छे से बात करता है, अच्छे काम करेगा तो आपको अच्छा लगेगा. तो आप भी यदि कुछ काले हो रहे तो कोई बात नहीं, आप अच्छा काम करिए, आप खुश रहिए. बिकॉज जब आप हाइड्रोक्सी क्लोरोक्विन खाएंगे थोड़ा रंग काला हो जाएगा, तो कोई बात नहीं. हमको काले, हम तो बोलते हैं जो काले हैं वो दिल वाले हैं, तो इसलिए डरना नहीं हमको काले से एकदम भी. तो थोड़ा रंग काला जरूर होता है, उसको हमें एक्सेप्ट करना है. हाइड्रोक्सी क्लोरोक्विन इज ए बेस्ट ड्रग फॉर लूपस अक्रॉस द वर्ल्ड. सो और इंडिया में तो अच्छा हम पहले ही काले हैं, थोड़ा और काले हो जाए क्या फर्क पड़ रहा है. जो लोग बहुत फेयर होते हैं उनका बहुत गंदा काला होता है, हमारा उतना गंदा काला नहीं होता है. तो इसलिए हमको कोई डरना नहीं है. और ये
Ma'am, actually, it's not about the skin complexion, but I've been
हाँ,
having bad pigmentation like spots on hands and legs. So apparently, पहले बहुत कम थे, but now they have just increased
so you have to
rapidly.
come and show. Then yours is an individual problem. We'll have to see that is what is it. So you come
Okay,
and show us, or you send a picture in the group. Then
sure,
we will see.
sure.
Okay.
Yeah, thank you.
Okay. Then yeah, what is Amit Goswami? Ma'am, many congratulations. Come under top 100 scientists in India. That doesn't matter. My scientists, I am happy with you people. That science is okay. My nails have also grown dark black, brown in color. If the nails are becoming dark brown, then you need to know that it is most likely fungal infection. So you will need to get a scraping done because nail fungal infections are very common in lupus patients, especially patients who are taking steroids, cyclophosphamide, mycophenolate, because all immunosuppressive drugs increase risk of fungal infections. And nails, because we are working all the time, so nail can get infected. So you need to go to the dermatologist, check, is it fungal infection? And for nail fungal infection, you need to take antifungal treatment for 3 to 6 months because nail has to grow totally normal. If you take for short time, it will not help. It will come back again. So if you don't mind, you can put a nail polish on it. That is fine. It is not going to make any difference, even if the fungal infection stays. Only thing is the nail becomes a little bit disorganized, may not be smooth. So if you don't want to take medicine for 3 to 6 months, you can just keep applying nail polish. Okay, Mudita, so we have done the job. Or we have anything more?
Anyone who would like to ask question? Because ma'am has already given so much precious time. And if you guys are not asking your question,
No, they have asked lots of questions. 1 hour,
yes.
15 minutes.
Yes, ma'am. It's about 6 to 11 now. Yeah. Anybody else have any question right now in their minds? किसी को कोई भी question पूछना है?
Otherwise, we can say goodbye to you. Thank you for joining.
Everybody can come on the camera. We can click a picture.
Yes.
We can take a
तो चले गए
screenshot.
तुम्हारे लोग.
नहीं है मैम, बहुत सारे हैं. 24 plus
Hello,
people are there.
ma'am. Suman here. Actually,
Yes,
I had
Suman.
another question. Yeah, ma'am. I just told in you just few minutes before that I
Yeah.
had three miscarriages
Pregnancy
in
loss.
yes, in second trimester with
Yeah.
LMWH 40 mg BD, HCQ 300 and with Ecosprin 150.
Yeah, you are the
And
one who seen Dr. Mishra, no?
yes.
Yeah,
And
just meet Dr. Mishra.
yeah. Yes, sir.
Yeah.
I just want to ask that for the rituximab, actually that is for lupus. Actually,
Rituximab
I
cannot
have
be given during pregnancy. It has to be given beforehand. Some people are trying that if you don't respond with even IVIG, then you can take rituximab prior to pregnancy, 6 months prior. Then if your
okay,
antibody levels come down, does it help? When people have just, there are case reports of all this.
okay, ma'am.
But the
Okay, ma'am.
standard treatment still is first is IVIG, steroids, this, and then if it doesn't help, then we will see. Don't worry.
Okay, ma'am.
First you
Okay,
take
ma'am.
this. This
Thank
is
you.
good.
Yeah. Yeah, and the last time we had taken LMWH 40 mg BT.
Yeah, that is a
So this,
therapeutic dose. So we give
yeah,
therapeutic dose. So
yeah, this
that
time
also
we,
helps some patients.
yeah, this time we are thinking that we will take LMWH 60 mg BT. So the
Yeah, that also people try. It depends on your weight, other things. So therapeutic dose of heparin, therapeutic dose. So whatever therapeutic dose comes for your weight, you have to take that.
yeah, my weight is 62 kgs current
So
now.
that
So
is why they must have given you 60 milligram. Yeah, BD.
okay, okay. Actually,
Okay, don't worry. We are praying for you, Suman. We are praying
Thank
for
you
you,
so
and
much.
you are in good
So
hand.
yes,
Dr. Mishra is a good person.
yeah, yeah, no doubt, no doubt.
Yeah,
He is
yeah,
God for us.
yeah, yeah.
Your name.
Okay, so
Just
Mudita, you
to
can have your photo if you want.
Yes, please switch
Yeah.
on your videos. We can have a
So we
photo.
can have Preeti, Ishita. Can you have your cameras on? Mudita
Yes.
wants all the cameras on.
Asli.
Mudita is a big teacher for us.
Ma'am.
excuse me, ma'am.
People who don't want to have is fine because I always
yeah.
feel
Yeah.
it should be privacy for patients.
Yes,
Um,
Patients
okay.
who don't want, don't
um,
have.
excuse me, ma'am.
Yes.
Ma'am, is it possible to repeat the doses of rituximab? Like currently, my doctor scheduled 4 doses of 500 mg each. So,
Yeah.
is it possible that after a couple of years, if it work comes back, if the remission breaks down, so we can take rituximab again?
Yeah. Oh, you can take it. Arams. No issues.
Okay. Okay. Thank you.
Okay, thank you everyone for joining, and especially we thank Amita ma'am for resolving all our questions which keep running in our mind off and on. And you are the great source of inspiration to us, ma'am. You keep motivating us. Thank you so much, ma'am. Asa, would you like to say something to ma'am?
Yeah, thank you so much, ma'am. You've always been so inspiring for us. At the same time, you are never hesitant to answer to all those sometimes silly queries coming from the patients. So we really want
No
to
question
thank
is
you
silly
from core.
ever. I always say no question is silly. I tell my students also that I ask more stupid questions because you must ask. Whatever is bothering your mind, ask it. And
Yeah.
nothing is stupid. It's all good.
Thank you so much. It means a lot. Thank you, ma'am, for
Okay, thank you
all the
everybody.
answers.
Thank
Thank
you,
you.
thank you, ma'am. Thank you, ma'am.
अभी मैं नेपाल आने वाली हूँ next year.
Yeah, that
Wow.
would
Ma'am, कब जा
we
रहे हैं?
should
हम भी
have a meet
चलेंगे.
and meet at that time. Yeah, ma'am. I will spend the time.
Okay, bye.
Thank you,
Bye.
ma'am. Thank you, ma'am.
Thanks, Mudita ji.
Thank you,
Thank
ma'am.
you, Asta. Thanks all for joining us. Thank you everyone for joining. Now we can talk and we can stop the live also. Let me stop the streaming also. Otherwise, everything will come in the streaming also.